Many people with Graves' disease actually have a negative test for thyroid antibodies. So while a positive test for thyroid antibodies, along with a positive radioactive iodine uptake test, will confirm you have this condition, one can't rely on the thyroid antibodies blood test alone. So while some doctors will recommend a TPO or a different blood test to detect thyroid antibodies when they suspect someone has Graves' disease, others won't recommend any of these blood tests at all. What is the purpose of receiving a blood test for thyroid antibodies? Well, normally antibodies are formed to protect the body from foreign molecules, also known as antigens. With Graves' disease, which is an autoimmune thyroid condition, the antibodies attack its own thyroid gland. So tests for thyroid antibodies such as the TPO can help determine the presence of these antibodies, although as mentioned before, one can't rely on these tests alone. As a holistic health care professional who was personally diagnosed with Graves' disease, I can tell you that while I do consider the test for thyroid antibodies to be helpful, there are other more useful tests which will actually determine the cause of this autoimmune thyroid condition. After all, while it's nice that there are tests to confirm you have Graves' disease, there are other tests which can help to determine the cause of this condition. Although most endocrinologists and other doctors consider Graves' disease to be incurable, many people have had their health restored back to normal by following a natural treatment protocol. Even though many healthcare professionals refer to Graves' disease as being an autoimmune thyroid condition, including myself, it really is an autoimmune condition which leads to thyroid malfunction. In other words, the malfunctioning thyroid gland is usually not the actual cause of the disorder in an autoimmune thyroid condition. This is why it is not uncommon to see positive thyroid antibodies without having a positive TSH, T3, and T4. So how does this process develop? What usually happens is that over a period of years, someone will develop an autoimmune condition which will trigger the thyroid antibodies to attack the thyroid gland. Why this happens isn't fully known, although there are numerous factors that are thought to contribute to the development of an autoimmune condition, such as poor eating habits, chronic stress, exposure to environmental toxins, and other factors. In any case, when the thyroid antibodies go on to damage the thyroid gland, this will eventually lead to the development of a thyroid condition, and thus is the reason for the positive thyroid tests. So is it really possible to cure Graves' disease? In many cases it is, although as I mentioned before, in order to cure Graves' disease, one needs to address the actual cause of the disorder. This is where conventional medicine fails, as most conventional medical treatments are aimed at managing the symptoms of the malfunctioning thyroid gland. For example, when I was initially diagnosed with Graves' disease by the endocrinologist I saw, she recommended antithyroid drugs along with a beta blocker to manage my symptoms. And while she didn't really talk much about radioactive iodine therapy, there is no doubt that if and when the antithyroid drug stopped working, which fortunately I didn't take, but this harsh treatment method would have been brought up as the solution. But nothing was ever mentioned by her as to how I should strengthen my immune system, and this is how most endocrinologists and other types of medical doctors think. Most don't try to do anything to cure the condition, but are trained to simply manage the symptoms. As I mentioned before, someone with Graves' disease won't always have a positive test for thyroid antibodies. The state of the immune system is always fluctuating, which doesn't necessarily mean that it is weak one minute and strong the next, but there are times when it is calmer than others, and so just because your thyroid antibodies test comes out negative doesn't mean that you don't have an autoimmune condition. This is why it's important to also consider the patient's symptoms, other thyroid blood tests, although once again these might be negative as well, along with other factors. Because of this, if someone with Graves' disease follows a natural treatment protocol, how can one tell if they have been cured? In other words, if they initially had positive thyroid antibodies, but after a few months of following a natural treatment protocol they have a negative test, how can one be sure if their condition is cured? The answer is that you can't confirm that someone is cured just by this test alone. You need to look at many different factors, including their thyroid blood test results, other tests that might be recommended, such as the adrenal stress index test, hormone panel, hair analysis, and of course their symptoms need to be considered as well. And let's face it, there's a fine line between the words cure and remission. What I mean by this is that while I use the word cure a lot, the truth is that someone who has had an autoimmune thyroid condition, or any thyroid disorder for that matter, and restore their health through natural treatment methods needs to maintain their health or else risk a relapse. How does this differ from someone who has had cancer, receives chemotherapy, and then is in remission? Well, it's similar, but in the case of most cancer patients, they receive a harsh passive treatment than chemotherapy, which doesn't actually address the cause of the cancer. So many people develop cancer again because they don't do anything to prevent a relapse from occurring. On the other hand, someone with a thyroid condition who has their health restored back to normal through natural treatment methods can keep up their health by following the steps that cured the condition in the first place, such as eating well, managing their stress, and other factors. In summary, the presence of thyroid antibodies and accompanying symptoms pretty much confirms the presence of an autoimmune thyroid condition, and by following a natural treatment protocol which restores your health back to normal, to no surprise this will cause the blood test to be negative. However, one can't rely on the absence of thyroid antibodies alone, as one also needs to consider the person's symptoms and other factors as well before coming to such a conclusion. To receive more natural thyroid health tips, please visit naturalendocrinesolutions.com, where you can get a free guide entitled The 6 Steps on How to Treat Graves' Disease and Hashimoto's Thyroiditis Naturally. This guide contains 100% pure content and is not a sales pitch for any product or service. Thanks for watching this presentation.